Every 6 minutes, someone dies from a blood clot, with seniors over 65 at the highest risk. Often developing silently, blood clots can lead to life-threatening events like strokes or pulmonary embolisms. Each year, over 900,000 Americans are affected, causing nearly 100,000 deaths, more than AIDS, breast cancer, and car accidents combined. But nature provides powerful fruits that help keep blood flowing smoothly, potentially preventing and even dissolving clots, without the harsh side effects of medication. And our top pick? A common kitchen ingredient proven in studies to rival aspirin's blood-thinning effects. Stay tuned as we reveal the 6 best fruits for fighting blood clots. Don't forget to like, comment, and subscribe for more health tips. Fruit number 6, kiwi. The small, fuzzy fruit packs a powerful punch when it comes to blood clot prevention. Kiwis contain an enzyme called actinidin, which helps digest proteins and break down fibrin in blood clots. Remarkably, this enzyme remains active even after passing through the acidic environment of the stomach, allowing it to provide systemic benefits throughout the body. Research from the University of Oslo found that consuming 2 to 3 kiwis daily reduced platelet aggregation by 18% in individuals with elevated cardiovascular risk factors. This effect is comparable to taking low-dose aspirin without the risk of gastrointestinal bleeding, a major concern for seniors on daily aspirin therapy. What makes kiwi particularly remarkable is how quickly it works. Some studies have shown measurable improvements in blood flow within just 3 hours of consumption, making it one of the fastest-acting natural blood thinners available. This rapid onset could be particularly valuable for seniors who experience periodic increases in clot risk, such as during long periods of sitting or after minor injuries. Kiwis also contain a unique combination of vitamin E, vitamin C, and polyphenol, which work together to reduce inflammation in blood vessels and improve endothelial function, the ability of blood vessels to dilate and contract properly. Proper endothelial function is crucial for preventing stagnant blood flow, where clots are more likely to form. Additionally, the small black seeds in kiwi contain omega-3 fatty acids, which further contribute to its anti-clotting properties by reducing the production of inflammatory compounds that trigger clot formation. For maximum benefits, eat kiwis with the skin on after washing them thoroughly, as the skin contains additional fiber and nutrients that support cardiovascular health. 1 medium kiwi provides about 70 milligrams of vitamin C, 2 grams of fiber, and significant amounts of vitamin K, which helps regulate the clotting process to prevent both excessive clotting and bleeding. Fruit number 5, grapes. Grapes, particularly the dark purple and red varieties, contain a remarkable compound called resveratrol that plays a significant role in natural blood clot prevention. This powerful antioxidant has been extensively studied for its cardiovascular benefits, with impressive results that are especially relevant to seniors. Research from the University of Connecticut demonstrated that resveratrol helps prevent blood platelets from sticking together, which is the first step in clot formation. What makes resveratrol truly special is how it accomplishes this. It doesn't just thin the blood, which can sometimes increase the risk of bleeding. Instead, it helps normalize clotting function, reducing excessive clotting while still allowing the body to form necessary clots when needed after an injury. Beyond its direct effects on blood clotting, resveratrol enhances vascular health by boosting nitric oxide production. Nitric oxide helps blood vessels relax and widen, improving circulation and reducing the likelihood of stagnation, a key factor in deep vein thrombosis, DVT, which is particularly concerning for seniors. Grapes also contain significant amounts of vitamin K, which plays a vital role in maintaining balanced blood clotting function. This ensures that while excessive clot formation is prevented, the body can still respond effectively to injuries. Fruit number 4, blueberries. While it might seem counterintuitive when discussing anti-clotting foods, balanced vitamin K levels are essential for proper clotting regulation, preventing excessive clotting while allowing necessary clotting when appropriate. The high water content in grapes provides an additional benefit for clot prevention, as proper hydration helps maintain optimal blood viscosity and prevents the blood from becoming too thick and prone to clotting. Many seniors struggle with staying adequately hydrated, making water-rich fruits like grapes particularly valuable additions to their diet. For maximum benefit, consume about 1 cup of fresh grapes daily, preferably with the skins intact, since that's where much of the resveratrol is concentrated. If fresh grapes aren't available, small amounts of purple grape juice without added sugar can provide some of the same benefits, though whole fruits are always preferable for their fiber content and lower sugar concentration. Blueberries might be small, but their impact on circulatory health is anything but minor. These tiny berries are packed with anthocyanins, the compounds responsible for their deep blue color and remarkable anti-clotting properties. Research published in the Journal of Nutritional Biochemistry demonstrated that regular blueberry consumption significantly reduced platelet aggregation in participants. In simple terms, blueberries help prevent blood cells from clumping together and forming dangerous clots. This effect was noticeable after just 1 week of regular consumption, an impressive result for such a simple dietary addition. Beyond their anti-clotting effects, blueberries contain powerful antioxidants that combat oxidative stress, a major contributor to blood vessel damage. By neutralizing free radicals, these antioxidants help maintain the integrity of blood vessel walls, reducing the likelihood of inappropriate clotting responses. What many people don't realize is that blueberries also improve blood vessel elasticity. As we age, our blood vessels naturally become stiffer and less responsive. The compounds in blueberries help restore some of this lost flexibility, allowing vessels to expand and contract more effectively with blood flow. For seniors, an added bonus is the cognitive benefits of blueberries. The same compounds that help prevent blood clots also support brain health and may slow cognitive decline, making them an excellent addition to the diet. To incorporate blueberries effectively, aim for about half a cup daily. They're delicious fresh, but they maintain most of their beneficial properties when frozen, making them accessible year-round. Try adding them to morning oatmeal, blending them into smoothies, or simply enjoying them as a naturally sweet snack. Fruit number 3, papaya. Papaya stands out among fruits for its exceptional ability to affect blood clots, primarily due to an enzyme called papain. This remarkable enzyme works directly on fibrin, the protein strands that form the structural foundation of blood clots. By breaking down these fibrin networks, papain can help dissolve existing clots and prevent new ones from forming. What makes papaya particularly valuable for seniors is that its clot-dissolving properties work gently and gradually, unlike some medications that can cause rapid changes in clotting factors. This gentler approach may reduce the risk of bleeding complications while still providing meaningful protection against dangerous clots. Beyond papain, papayas contain exceptionally high levels of vitamin C, even more than oranges by weight. This abundant vitamin C supports collagen production, helping maintain the structural integrity of blood vessel walls. Strong, flexible blood vessels are less likely to develop small tears and damage, which can trigger unnecessary clotting responses. Papayas also provide significant amounts of folate and potassium, 2 nutrients that work together to regulate homocysteine levels in the blood. Elevated homocysteine is linked to an increased risk of blood clots and cardiovascular problems, making this regulatory effect particularly valuable for seniors. For those concerned about diabetes, papaya has a relatively low glycemic index compared to many other tropical fruits, making it less likely to cause problematic blood sugar spikes when consumed in appropriate portions. To incorporate papaya effectively, consume about 1 cup of fresh papaya chunks several times a week. The enzyme concentration is highest in slightly underripe fruit when the flesh is still firm with some greenish areas on the skin. For convenience, frozen papaya works well in smoothies, though some enzyme activity may be lost in the freezing process. It's important to note that papaya enzymes may interact with certain blood thinners. If you're on anticoagulant medication, consult your doctor before making papaya a regular part of your diet. Fruit number 2, pineapple. Pineapple is perhaps the strongest fruit for fighting blood clots, thanks to bromelain, an enzyme complex so effective at dissolving fibrin that it's actually used in some medical treatments and has been extensively studied for its therapeutic potential. Studies published in the Journal of Medicinal Food have demonstrated that bromelain can break down fibrin with efficiency comparable to some pharmaceutical approaches, but without many of the side effects associated with conventional medications. For seniors concerned about blood clots but wary of medication side effects, this natural alternative deserves serious consideration. What sets bromelain apart from many other natural blood thinners is its dual action. It not only helps dissolve existing clots but also prevents new clots from forming by inhibiting platelet aggregation. This comprehensive approach provides both immediate and long-term protection against dangerous clot formation. Impressively, bromelain's benefits extend beyond direct clot dissolution. It's also a powerful anti-inflammatory agent that helps reduce inflammation throughout the circulatory system. Since inflammation often triggers the clotting series inappropriately, this anti-inflammatory action provides another layer of protection against dangerous clot formation. Pineapple also delivers significant amounts of manganese, a mineral that supports the production of several enzymes involved in blood vessel repair and maintenance. Healthy, well-maintained blood vessels are less likely to develop small damages that can trigger unnecessary clotting responses. Additionally, the digestive benefits of pineapple provide an extra advantage for seniors, as better digestion means improved absorption of other nutrients essential for cardiovascular health, creating a foundation for overall circulatory wellness. For maximum benefit, consume about 1 cup of fresh pineapple daily, focusing on the core area where bromelain concentration is highest. The fruit should be fresh rather than canned, as the canning process destroys much of the bromelain activity. If the acidity causes mouth irritation, which is common for some, consuming pineapple with a small amount of protein can help neutralize this effect without reducing its blood-thinning benefits. While natural bromelain is potent, if you're already taking blood thinners, have bleeding disorders, or are scheduled for surgery, consult your doctor before making pineapple a daily part of your regimen. Fruit number 1, ginger. While technically a root rather than a fruit, ginger deserves the top spot on this list due to its remarkable ability to prevent and potentially dissolve blood clots. Ginger contains compounds called gingerols and shogales, which have been shown to be more effective than aspirin at preventing platelet aggregation in laboratory studies. These natural compounds work by inhibiting thromboxane production, a key factor in unwanted clot formation, without the gastrointestinal side effects that concern many seniors taking daily aspirin. What makes ginger particularly powerful is its multifaceted approach to fighting clots. It not only prevents platelets from sticking together but also improves fibrinolysis, the body's natural process for breaking down already formed clots. This dual action makes it uniquely important for both prevention and potentially addressing existing clot concerns. Research published in Prostaglandins, Leukotrienes, and essential fatty acids demonstrated that ginger extract reduced the formation of thromboxane, a potent platelet aggregator, by up to 60%, a remarkable finding that has prompted further clinical research. This reduction is comparable to what's seen with prescription blood thinners but without the risk of excessive bleeding, which makes many seniors hesitant to take such medications. Ginger also contains salicylates, natural compounds similar to aspirin, and its warming properties improve circulation, helping blood flow more freely throughout the body, particularly in the extremities where poor circulation often creates conditions for dangerous clots to form. The compounds in ginger appear to have cumulative effects, meaning that regular, consistent consumption provides greater benefits than occasional use. This makes it ideal for incorporation into your daily routine as a preventative measure. Even more remarkably, some of ginger's blood-thinning compounds are heat-stable, meaning they remain active even after cooking, unlike many other natural enzymes that break down with heat. To get the most benefits, fresh ginger is best, though high-quality supplements can also be effective. Try adding freshly grated ginger to smoothies, teas, or cooked meals. Even a small amount daily can provide significant benefits, as just 1 teaspoon of fresh ginger contains compounds that can measurably improve blood flow and reduce clotting risk within hours of consumption. For seniors concerned about its spicy flavor, crystallized ginger offers a more palatable option while still providing many of the blood-thinning benefits. Always consult your doctor before making dietary changes, especially if you're on blood thinners like warfarin. Some fruits may enhance medication effects, increasing the risk of excessive bleeding. By adding these powerful fruits to your diet, you're actively supporting heart health and circulation. Start small and gradually increase your intake for maximum benefits. Combined with a balanced diet, these natural blood thinners can significantly reduce clot risks as you age. Which of these fruits do you eat regularly? Have you noticed any benefits? Share your thoughts below.